Devices for Dignity is a MedTech co-operative. We're funded by the National Institute for Health Research, and we're set up to develop new healthcare technologies, medical devices for patients with long-term conditions in order to help to improve their dignity and independence. So we work very much in cooperation. We work with the patients and members of the public and carers. We work with industry, we work with academics, and of course we work with our colleagues in the NHS as well.
For the NHS to be innovative and move forward in the future, it's really essential that there are organisations like D4D to explore the true underlying needs for the NHS, for the patients of the NHS. It's only by addressing those, understanding them, and then being able to articulate those problems to academia and to business that we can get the solutions that can really meet an underlying unmet need.
One of the main benefits that D4D brings to Sheffield teaching hospitals is that you put together industry, academics and the hospital staff, and together they come up with some great solutions. And we've already seen that the head-up collar is the most recent example of a brilliant solution to a problem.
In the last 10 years, D4D has been able to deliver several breakthrough technological innovations in unmet patient need, whether it be in trying to improve transport to dialysis units or early diagnosis of infections to reduce complications on dialysis, and other solutions that have had a direct impact on patients' experience of health and social care. Ultimately, we'd like to be able to say to our patients that you said it and we did it.
Devices for Dignity has put patients right at the heart of innovation, and it's worked so closely with SMEs to make sure that we harness the fantastic innovation that we've got in this country, but in a way that responds directly to patients' needs and priorities. And that is absolutely a recipe for the future of what we need to achieve in this environment for the NHS.
D4D already collaborates with 13 universities across the UK and other institutions around the world. I think what's really important for us in the future is to bring more academic groups in so that we can produce even more of the brilliant innovations that the people that D4D serves rely on.
This year the NHS celebrates its 70th birthday, and we also celebrate our 10th year in operation. Over those 10 years we've worked with so many people and developed many technologies which are now benefiting patients. And we're looking forward in the future to continuing expanding that role and to evolving within the future NHS.